Greeting viewers. If something went wrong with your heart, would you know it? Heart disease is the leading cause of death in the United States, according to the Centers for Disease Control and Prevention. In the United States, 1 in every 4 deaths is the result of heart disease. That's about 610,000 people who die from the condition each year. Heart disease doesn't discriminate. It's the leading cause of death for several populations, including white people, Hispanics, and black people. Almost half of Americans are at risk for heart disease, and the numbers are rising. Learn more about the increase in heart disease rates. While heart disease can be deadly, it's also preventable in most people. By adopting healthy lifestyle habits early, you can potentially live longer with a healthier heart. What are the symptoms of heart disease? 1. Pain that spreads to the arm. Another classic heart attack symptom is pain that radiates down the left side of the body. It almost always starts from the chest and moves outward. But I have had some patients who have mainly arm pain that turned out to be heart attacks. 2. You feel dizzy or lightheaded. A lot of things can make you lose your balance or feel faint for a moment. Maybe you didn't have enough to eat or drink, or you stood up too fast. But if you suddenly feel unsteady and you also have chest discomfort or shortness of breath, call a doctor right away. It could mean your blood pressure has dropped because your heart isn't able to pump the way it should. 3. Chest discomfort. It's the most common sign of heart danger. If you have a blocked artery or are having a heart attack, you may feel pain, tightness, or pressure in your chest. Everyone has a different word for that feeling. Some people say it's like an elephant is sitting on them. Other people say it's like a pinching or burning. The feeling usually lasts longer than a few minutes. It may happen when you're at rest or when you're doing something physical. If it's just a very brief pain, or if it's a spot that hurts more when you touch or push on it, it's probably not your heart. You should still get it checked out by a doctor. If the symptoms are more severe and don't go away after a few minutes, you should call 911. Also, keep in mind you can have heart problems, even a heart attack, without chest pain. That's particularly common among women. 4. You get exhausted easily. If you suddenly feel fatigued or winded after doing something you had no problem doing in the past, like climbing the stairs or carrying groceries from the car, make an appointment with your doctor right away. These types of significant changes are more important to us than every little ache and pain you might be feeling. Extreme exhaustion or unexplained weakness, sometimes for days at a time, can be a symptom of heart disease, especially for women. 5. Snoring. It's normal to snore a little while you snooze. But unusually loud snoring that sounds like gasping or choking can be a sign of sleep apnea. That's when you stop breathing for brief moments several times at night while you are still sleeping. This puts extra stress on your heart. Your doctor can check whether you need a sleep study to see if you have this condition. If you do, you may need a CPAP machine to smooth out your breathing while you sleep. 6. A cough that won't quit. In most cases, this isn't a sign of heart trouble. But if you have heart disease or know you're at risk, pay special attention to the possibility. If you have a long-lasting cough that produces white or pink mucus, it could be a sign of heart failure. This happens when the heart can't keep up with the body's demands, causing blood to leak back into the lungs. Ask your doctor to check on what's causing your cough. 7. Irregular heartbeat. It's normal for your heart to race when you are nervous or excited or to skip or add a beat once in a while. But if you feel like your heart is beating out of time for more than just a few seconds, or if it happens often, tell your doctor. In most cases, it's caused by something that's easy to fix, like too much caffeine or not enough sleep. But occasionally, it could signal a condition called atrial fibrillation that needs treatment. So ask your doctor to check it out. 8. Sweating. Breaking out in a cold sweat for no obvious reason could signal a heart attack. If this happens along with any of these other symptoms, call 911 to get to a hospital right away. Don't try to drive yourself. 9. Throat or jaw pain. By itself, throat or jaw pain probably isn't heart-related. More likely, it's caused by a muscular issue, a cold, or a sinus problem. But if you have pain or pressure in the center of your chest that spreads up into your throat or jaw, it could be a sign of a heart attack. Call 911 and seek medical attention to make sure everything is all right. 10. Nausea, indigestion, heartburn, or stomach pain. Some people have these symptoms during a heart attack. They may even vomit. Women are more likely to report this type of symptom than men are. Of course, you can have an upset stomach for many reasons that have nothing to do with your heart. It could just be something you ate, after all. But you need to be aware that it can also happen during a heart attack. So if you feel this way and you're at risk for heart problems, let a doctor find out what's going on, especially if you also have any of the other symptoms on this list. What are some risk factors for heart disease? There are many risk factors for heart disease. Some are controllable, and others aren't. The CDC says that around 47% of Americans have at least one risk factor for heart disease. Some of these risk factors include high blood pressure. High cholesterol and low levels of high-density lipoprotein are the good cholesterol. Smoking. Obesity. Physical inactivity. Smoking, for example, is a controllable risk factor. People who smoke double their risk of developing heart disease, according to the National Institute of Diabetes and Digestive and Kidney Diseases. People with diabetes may also be at higher risk for heart disease because high blood glucose levels increase the risk of angina, heart attack, stroke. If you have diabetes, it's essential to control your glucose to limit your risk of developing heart disease. The American Heart Association reports that people who have both high blood pressure and diabetes double their risk for cardiovascular disease. What lifestyle changes does heart disease require? If you've recently received a heart disease diagnosis, talk to your doctor about steps you can take to stay as healthy as possible. You can prepare for your appointment by creating a detailed list of your everyday habits. Possible topics include medications you take, your regular exercise routine, your typical diet, any family history of heart disease or stroke, personal history of high blood pressure or diabetes, any symptoms you're experiencing, such as a racing heart, dizziness, or lack of energy. Seeing your doctor regularly is just one lifestyle habit you can take up. If you do, any potential issues can be caught as early as possible. Certain risk factors, such as high blood pressure, may be addressed with medications to lower your risk of heart disease. Your doctor may also provide tips for quitting smoking, controlling the blood pressure, exercising regularly, maintaining healthy cholesterol levels, losing weight if you're overweight, eating healthy. Making these changes all at once might not be possible. Discuss with your healthcare provider which lifestyle changes will have the biggest impact. Even small steps toward these goals will help keep you at your healthiest. When to call the doctor. If you have any signs of heart disease, call your healthcare provider right away. Don't wait to see if the symptoms go away or dismiss them as nothing. If you want to learn more about signs and how to get rid of heart diseases, click the link in the description below to learn more. If you liked the video, give it a thumbs up and share it with your friends. For more secrets and tips, subscribe to the channel. There are 2 more videos you should see. Both of them will undoubtedly assist you to achieve your goals. See you in our next video.